Dr. Joy Varghese, Senior Consultant Neurosurgeon and Endovascular Neurosurgeon, Apollo Hospitals, Chennai. October 29th is World Stroke Day. So today, I would like to talk to you regarding brain regeneration and acute stroke. We all might have seen how a tissue heals after an injury. For example, we have a cut injury on our hand or our fingers. It heals over a period of time. We repeatedly do the dressings and it heals by scarring. There will be a scar which is formed over the wound. And the scar will become denser and denser as the time goes. It will become tougher. Scar is basically meant for covering up the wound in such a way that it doesn't get opened up by shear strain. This is the usual way of healing of human body. But when you touch over the scar, you cannot feel properly. And if you cut open the scar, it will not bleed like normal tissue. Bleeding will be different. That shows that the nerves and the blood vessels which comes into that tissue is different or in a different manner than the normal tissue. Or in another way, the scar is not a normally formed tissue. There is a lot of difference between healing and regeneration of damaged tissue. In brain also, whenever there is an insult to the brain which happens either due to an ischemic insult where the blood circulation gets cut off to a particular area, or a bleeding happens inside the brain due to a hemorrhage due to hypertension or increased blood pressure, or an injury which happens after a traumatic brain injury, a road traffic accident or so, will also behave the same way. By healing, it produces scarring which we call gliosis. Gliosis is a technical term to represent the scar formation in brain. Here in our hands or legs we call it scar, but in brain we call it gliosis. Because the glial cells are the supporting cells of the brain which comes in action to form that healing of that area which got the insult. So in brain, apart from the neurons or the nerve cells, there are other cells, the supporting cells we call them. They are astrocytes, oligodendrocytes, pericytes and all that. You don't have to remember that, but you have to understand that apart from the neurons, which are the nerve cells, there are other cells also in the brain, which also need to be given oxygen and nutrients and make sure they are surviving so that the brain function is not hampered. So if for total we take the brain, it is not just neurons. In addition to neurons, there are the supporting cells as well as the blood vessels which supply the supporting cells as well as the neurons. So when a stroke happens, there will be a cutoff or disruption of blood supply to a particular area of the brain. So there will be a cutoff of oxygen and nutrients to that particular area of the brain. So naturally, the cells will die off. The neurons die. The supporting cells like astrocytes, oligodendrocytes, pericytes, all of them die. The blood vessels which were supplying to that particular area, because the blood is not coming to that area, the cells which form the blood vessels also die. So a particular milieu or the environment is created in that dead area. The dead area we call umbra. There will be a dying area around, which is with reduced blood supply but not completely off. We call penumbra. Now, this dead area is in an environment which is enough or which is adequate enough to produce certain mediators or chemicals which can impact the rest of the brain to help regeneration of brain tissue in the dead area. In our school and college days, we had been taught that brain cells don't regenerate. To a large extent, it is correct. The nerve cells don't regenerate to a large extent compared to the rest of the tissues, it is correct. But there is a particular system which is in play in the brain, which allows, rather than healing, regeneration of the tissue in the dead space. That's what we are going to discuss today. So when we consider brain, it is very, very active throughout 24/7, 365 days. Understand that there is a migratory stream of cells which is happening in the brain all the time without our knowledge. This migratory stream I am talking about is of stem cells. I hope you are aware about stem cells. The stem cells are cells which are undifferentiated, means they are not for any specific function made, but they can differentiate it into cells which can carry out special functions or specific functions. They are called stem cells. So, in brain, there is a particular area in the brain which can produce these stem cells, or thousands and thousands of stem cells are made every day in that particular area of the brain. We call that area called subventricular zone. It may be a technically difficult name for you to remember, but understand that inside the brain, if you take the brain like this, deep inside the center of the brain, there is a cavity called ventricle. That is water-filled cavity. Or everyone will be having that. We call them lateral ventricles. The brain which is closer to the lateral ventricle, we call it the subventricular zone. There is an area in the subventricular zone, the behind part, the posterior part or the behind part of the brain, which produces these cells, the stem cells or the neuroblasts. These neuroblasts are produced in a minute-to-minute basis in this particular area, and they go in a chain, just like a train. One by one get attached to the next one and so on, making a chain. And this chain migrate slowly towards the olfactory bulb. Olfactory bulb means the area in the brain which sends the smell. That is situated behind the nose. So understand that there is a flow of cells, the stem cells, from the subventricular zone, which I told you in the center of the brain. It keeps flowing or migrating. It's not actually flowing, it actively migrates, just like how the migrating animals migrate, just like how the migrating birds migrate. These cells also keep migrating into the olfactory bulb, which is sitting behind our nose. This stream of cells which keep migrating, we call them rostral migratory stream, or RMS. This migratory stream is a stream of stem cells which can be used by brain to differentiate them and make them into special cells which can produce special specific functions. So what happens in a stroke, or for example any dead tissue which happens, for example due to any insult, by trauma or stroke or hemorrhage or whatsoever? There is a dead tissue there. There is an area which is going for a catastrophe there due to reduced availability of the nutrients and oxygen. When the cells die, as I told you, there will be an environment which is created there which allows certain mediators, certain chemicals to be produced by the dead cells, which acts as chemoattractants Chemoattractants means certain chemicals which attract. Attract what? These stem cells. These stem cells, which are produced in the subventricular zone, which migrates in the rostral migratory stream, will get pulled or attracted into the area which is damaged. And these cells are stem cells, understand that. They can go to this place, repair the tissue which is damaged, and replace with specific cells which can do the functions of the dead cells. This helps a lot in brain plasticity. In training ourselves, where we are, for example, we are paralyzed in one side, by training ourselves, we are helping the brain plasticity. Meanwhile, inside the brain, understand that these cells, which are the stem cells which are produced in the subventricular zone, get migrated into the area which is damaged, and that area becomes regenerated with tissues which are required for carrying out the movement of the limbs. So this is brain regeneration. When we go into the intricacies of stroke, understand what happens in stroke is the arteries which are supplying the brain are blocked. Now the arteries are not flowing any more blood. So naturally, the cells which are covering the arteries or making the arteries are also not functioning properly. I told you about the rostral migratory stream, about the cells which are migrating all along like a train. But this migration will happen more efficiently along the arteries which are supplying the brain. These are recent understandings in science. So when the blood is flowing through the arteries, it helps as a scaffold for this train of migratory stream of stem cells or neuroblasts to move all along the arteries which are carrying the blood. Not through the artery, but along the arteries, outside the arteries. But when these arteries are blocked and doesn't work and damaged and so on, this migratory stream cannot take the help of these scaffoldings of these arteries to migrate this efficiently and effectively. Because I told you about the chemoattractants or the chemicals which are secreted by the dead part of the brain. They are secreted by endothelial cells of the arteries. So certain amount of functions of these arteries, if they are remaining, it will help for getting the correct chemicals which are required for as chemoattractants to pull this migratory stream to the area. So these migrating cells will naturally find its way to the damaged area. They are stem cells. They go to the damaged area along the scaffoldings of the arteries, which are running with blood, and reach the area where it is damaged and regenerate the tissue which is required for the functions of the brain. I hope this part is clear. So what happens? When we open up a major artery occlusion, we are helping the arteries which are distal to the part which is blocked to function properly, and thus to help these stem cells to reach the area which is damaged and allow the brain to regenerate to a large extent. This is a big advantage of opening up the arteries which are blocked. So when a stroke happens, the initial insult is due to the reduced oxygen supply and the nutrient supply to a particular area, because of which there will be dying of the tissues, which produce the milieu or the chemicals which are required for the stem cells to get attracted. When we open up the arteries, we are in fact helping these migratory stream to direct all the way to the dead tissues and repair them and replace them. That is why, in fact, when we do recanalization or mechanical thrombectomy, when we do the opening up of the artery which is blocked, the patient recovers over a period of time, and in those patients who are not, the arteries are not opened, they don't recover that much in the coming period of time, in the following period of time. If the arteries which are not blocked, in the cases of arteries which are blocked and not opened, they recovers maximum over a period of up to 3 months or 2 to 3 months. But the patients where the arteries are open, they continue to improve for a period of 1 year up to 1.5 years and becoming better and better. This is a big advantage of recanalization, which helps in brain regeneration. The second part of it I will tell you. Now I told about the stem cells as well as the blood vessels. One thing more you should understand is the supporting cells of the brain. We call them astrocytes. Apart from neuron or the nerve cells, there is a group of cells called astrocytes which help in many ways for the functioning of the brain, especially when the neurons get damaged in this reparative work or for the regeneration of the brain tissue. The astrocytes help in a large extent. So once we recanalize the arteries, we are also rejuvenating these astrocytes, the supporting cells, in addition to the nerve cells. So the supporting cells, the astrocytes, as well as the blood vessels having the endothelium, helps in the regeneration of the neurons or the nerve cells. So recanalization is so important, as we understand. The second part I would like to emphasize on something called the glymphatic system or G-lymphatic system. Every part of the human body, as they function, as the metabolism happens, there will be waste products which are part of metabolism. It need to be excreted out. This excretion of the waste material in brain is done through a system called glymphatic system. More and more studies started on this glymphatic system from 2012 onwards, and we have now a better idea about this glymphatic system. Whenever a damage happens to a particular area of the brain, it is natural to have more waste material because the dying tissues will be there, and the more and more nutrients has to reach the place and the waste material has to be discarded. So naturally, there is more need of this glymphatic system to work efficiently in that particular area of damage, that the complications of the damage will be lesser. You might have heard the doctors saying when a patient comes with a brain injury or an ischemia or a stroke, the first 5 days are critical. This is because the maximum swelling of the brain happens in the first 3 days, and the third day will be the maximum swelling of the brain happens, which produce various complications. And then the swelling slowly over a period of weeks, it reduces. If glymphatic system is working properly, the swelling of the brain reduces faster. That is another advantage of recanalizing this artery. The arteries which are blocked, as we recanalize them, as we open them, there will definitely be an increase in the swelling, but at the same time, it also helps to reduce the swelling as after the initial insult. The reduction of the swelling will be much more faster. So only if the arteries are open. So being the arteries open, when the arteries get recanalized, the brain regeneration is helped in many ways. After that, two important ways is that one is the rostral migratory stream of cells, of stem cells, get diverted into the area of damage, and this is also helped by the supporting cells called the astrocytes, which also will remain functioning if the arteries are opened. So the rostral migratory stream gets connected with the damaged area with the help of the arteries which are functioning, because it is recanalized. At the same time, the astrocytes which help, or the supporting cells of the brain, which helps this migration of the cells, also will be functioning because the artery is opened and the oxygen is reaching at that particular place. So the carry-home message is that by opening up the arteries, we are getting double advantage. One is the dying cells will become lesser and lesser in number. There will be less number of cells will be dying, that the nerve cells I am talking about. We can salvage a lot of cells which otherwise would have died. Second thing is, it helps in a bigger way in regeneration of the tissues which are dead, thus helping the patient to have a better outcome after acute stroke. Thank you very much for your patient listening.